Welcome, everyone. We will get started in just a moment. We are just going to let everyone get settled in the room. All right, welcome everyone. Please feel free to introduce yourself in the chat. We'll get started in just a second.
Welcome, everyone. Welcome back to many of you who are regulars in the WashFit community of practice. And welcome to those of you who are joining us for the first time. We've been doing these webinars convened by WHO and UNICEF, an average of 2 times a year. And this is really to share insights and experiences on all things WashFit. So WashFit, for those of you who are new, is the Water and Sanitation for Health Facility Improvement Tool. This is a participatory, risk-based, incremental improvement process for improving infection prevention and control in healthcare facilities. My name is John Brogan. I'm with Helvetas and with the Swiss Water and Sanitation Consortium. And today we'll be focusing on sharing insights about implementation of WashFit in different contexts, in different countries. We'll be looking at challenges and some solutions for overcoming those challenges. We have 3 main aspects we'll be looking at today. The first is how WashFit has helped us to further climate-related goals. The second is how it is used for costing. So also understanding the investments that we need for the costing, but also how to advance on getting those investments made. And the third is looking at country-level processes whereby WashFit has been integrated and it's been supporting the national health system. We'll be hearing from colleagues from the Philippines, from Mozambique, Ethiopia, and Mali. And we'd love to hear from all of you. So at any time today, you're hearing something, you have a question, you would like to share an experience or a success story, please make use of the chat window. Introduce yourself and let us know what your question is or what you would like to share as your own experience. So we'll be having time in the second half of the program today for Q&A. We've reserved about 20 minutes in the second half of the session. So we'll be looking forward to getting your interaction and your input. With that, I'm pleased to invite Arabella Hayter, who is the WHO lead for WashFit, to share what's new, what's going on in the WashFit space globally. And Arabella, I think you also have some questions for us, so we have to be ready for those at a certain point.
Super. Thanks very much, John, for that introduction. And thanks to you all for taking the time to join today's webinar, wherever you're joining from. It's great to see so many people online already. So John gave a very good introduction there just to set the scene about the WashFit community, which we know is particularly active. There's lots of people who we know are using WashFit around the world. And this WashFit technical webinar is in response to requests at the Global Summit in Jordan earlier this year for more technical support around WashFit. And particularly, we find that countries often ask us what has worked in other countries, what are the real things that lead to success in WashFit. And so we, as WHO and UNICEF, are attempting to help answer that question by conducting a large mapping exercise of where WashFit has been used to date. We know anecdotally that it's probably been used in about 50 countries, but to what extent and in how many facilities and to what outcomes, we don't yet have that information. So we've launched an online survey, which is currently open, and we'll share the link in the chat box today. We invite everybody on the call here today and other colleagues who may be using WashFit to complete the survey. So the survey should take about half an hour to complete, and it looks like there's a lot of questions, but for many users, not all questions will be applicable to all users. It really depends on the extent to which WashFit has been implemented. And I received a question earlier today. What shall I do if I haven't yet started WashFit and I'm interested in starting it? Should I also fill out the survey? Yes, please. We would love to hear from you. We're as interested to know which countries are yet to start WashFit as those that have already started the process, whether it's small scale pilot projects or larger national scale up and implementation. And we'll hear from a couple of countries today with examples of how they've scaled up implementation nationwide. We so far have, I think, 25 countries have submitted responses to the survey, and we know that there's many more countries already using WashFit who haven't responded, so we please do encourage you all to take the time to do that. We'll hear later on today about this WashFit community and the next steps of how we can take this group forward, how we can continue to share information and exchange and examples of WashFit implementation. Lindsay is going to launch a poll to find out just a quick set of questions from all of you, how many of you are using WashFit, so please do take the time to answer that poll. And with that, I'm going to pass to our next speaker, who has...
Arabella, the poll is up, so let's just give everyone a chance to answer it. You should see it on your screen right now. There are 4 questions. If you can just take 60 seconds, 90 seconds to answer, going through the questions. We have a question here. Have you used WashFit before? The second question, if you have used WashFit, which step from the WashFit cycle has your country or program implemented? And this is actually going by the steps, whether you're on step 1, step 2, step 3, step 4, step 5, or step 5, of course. And then question 3, which of the following resources have you made use of to support WashFit implementation? This is looking at the materials available, like the guide and the training manual. And then lastly, what kind of activities would be more useful for you to help implement WashFit in the future? Webinars such as this, case studies, attending a training, or drop-in calls. So please just take another moment here. It looks like I have about 25 or 30% of you who have voted. And let's take a second and get your responses, and we can discuss them before jumping into the next speaker. Thanks. And I can see now the chat is working. Apologies with that. We now have it open. You can chat with everyone. So please go ahead and introduce yourself in the chat. Sorry for that little technical snafu this morning, but we've got it working.
Thanks, Lindsay. Sorry, I can't see the whole Zoom room because I'm sharing, but would you like me, are we ready to start the video or?
Give it one more second. I think we've got about 45 people who voted. Take a second here. And once that's done, I will go ahead and share the results. You may not be able to see it, Arabella, because you're sharing right now. But we've got people coming in with all sorts of votes here. Take 30 more seconds. The poll's been up for about 2 minutes. Ooh, and we have at least one person saying other things you'd like in the that you would like to have used for WashFit. If you have any further thoughts on what resources would be available or useful or activities, please share in the chat. Would love to see your answers here. All right, last 10 seconds. Get your answers in, folks. All right, fantastic. This is looking great. All right, I will share the results here. So it looks like Um, 44% of you have used WashFit, but about 56% of you have not. So fantastic. Welcome to those of you who have not used WashFit before. If you have used WashFit, which steps of the WashFit cycle has your country or program implemented? It looks like majority of you are starting the WashFit journey. You've not yet started step one, but some of you, 35% of you are on step one, 18% on step two, only 3%, 18% also on step three, 18% on step four. And then a few of you are fully in step five here. 12% of you are on step five. Which of the following resources have you made use of? Great to see that everyone is taking advantage of this guide. So 64% of you are using the WashFit guide. That's fantastic. The training manual, 54% of you have found that useful. 46% of you are using slides, and a quarter of you didn't know the resources existed. So we will share the link to those in the chat. And then it looks like majority of you all are looking to attend a WashFit training or use webinars or more example case studies. A few of you would like drop-in calls. And again, if you have other ideas, please go ahead and share with the chat. So I'm going to close up the poll and hand back to you, Arbella, so we can hear from the other colleagues.
Great. Thank you very much, Lindsay. So bear with me and I will just share a video from the Philippines.
Arbella, we're not seeing it at the moment. Oh, there it is. Okay.
From the Philippines Department of Health, and today I will be giving the brief overview of the national adaptation of WashFit with a climate focus. Cognizant of the impact of the climate change on the country, the Philippine Development Plan, or the PDP, was updated to account for the climate change. The PDP defines human security, a state where the rights of Filipino family and individuals, especially the poor and vulnerable, are protected and promoted through the access of education, housing, social protection, and health, while ensuring environmental sustainability. Moreover, through the National Climate Change Action Plan, or the NCCAP, the current situation of the country related to the climate change risk outlines strategies on adaptation and mitigation, which includes strategies involving the health sector, of which the Department of Health is an active contributor to. On the other hand, the Universal Healthcare Act provides a comprehensive framework for health systems improvement. The reform calls for a paradigm shift in provisions of care from being fragmented and facility-based to having a network of care with primary care facilities acting as navigator through the network. The Universal Healthcare Act envisions an equitable health systems where every Filipino can access appropriate and quality healthcare without financial hardship. Through the Philippine Health Facility Development Plan 2020-2040, equitable access to health system is the goal. The Philippine Health Facility Development Plan is the master plan for infrastructure and medical equipment investments to ensure that our health systems can meet the demand of the universal healthcare. Here's the hospital accessibility map analysis was done to calculate the proportion of the provincial population with access to a hospital within 1 hour and to primary care facilities within 30 minutes. Pursuant to Republic Act Number 11936, or the General Appropriations Act of 2023, all government instrumentalities, national and local, are mandated to adopt a whole-of-government approach towards the climate, the nation's economic transportation towards inclusivity and sustainability. Specific to health facilities, a specific provision in Section 17 on the Green Hospitals states that the Department of Health shall as much as possible promote the greening of hospitals and health facilities, including the improvement of energy and water efficiency and conservation, the sustainable cooling system, and sustainable healthcare waste management in hospitals. It also includes the Department disaster risk reduction and climate change adaptation and mitigation in all agencies, programs, and projects. In 2021, the Department of Health released the Green and Safe Health Facilities Manual to respond to the global call for minimizing the carbon footprint of the health sector while continuing to provide healthcare that is quality and safe, thereby setting the minimum green and safe standards for all hospitals through the Department Circular 2021-0437. The Green Manual contains the following performance standards and guidelines. We have the governance, the energy efficiency, the water efficiency, sanitation and hygiene, the healthcare risk management, the environmentally resilient health facility, material sustainability, site sustainability, and indoor environmental quality. Recognizing water efficiency, sanitation, and hygiene as one of the performance standards of the Green Manual, the operational guidelines and standards for water and sanitation for health facility improvement tool or WashFit has been simplified to allow the straightforward application of the tool and prompt development of the wash improvement plans. The value of WashFit in systemizing and harmonizing assessment and improvement of the wash and health facilities. This localized version of WashFit has been developed with the objective of better aiding Philippines' health sector by taking into account the relevant local context. The Department of Health, WHO, and UNICEF modified the global version of Tool to A indicators assessment and integrating national standards for health facilities and prioritize those that are relevant to the IPC measures. We have the national indicators of 34 and global indicators of 13, equivalent to 50 total indicators for WashFit. This includes the minimum required indicators to be assessed regardless of the health facility size, as well as standards for indicator which will be basis of rating. Guidance notes of each indicator was also included to help in accurate assessments of the indicators. A climate resilient health system is one that is capable to anticipate, respond to, cope with, recover from, and adapt to climate related shocks and stress, so as to bring sustained improvements in population health despite an unstable climate. Here are some of the climate change related WashFit indicators. To recognize hospitals and health facilities, the Department of Health developed criteria and equivalent rating systems through the technical assistance of the green experts, professionals, and stakeholders. Wash and health facilities, particularly on wash feet, is being monitored at the water efficiency, sanitation, and hygiene performance standards, including the Water Safety Plan and Sanitation Safety Plan. Hospitals are recognized according to the assessment and validation of the Health Facility Development Bureau, Center for Health Development, and Green Building Professionals. As of October 2023, there are 105 government hospitals that has been recognized for green health facilities. As part of the commitment of the health sector strategy, the Green Health Facilities Conference was conducted to recognize the government hospitals. This is in line and in time for the National Climate Change Consciousness Week, pursuant to Proclamation number 1667. Here are some of the relevant resources that you might want to look. Again, maraming salamat po. We look forward to a greener, safer, and healthier health systems for all.
That's wonderful. Thanks to Philip Ruiz from the Department of Health of the Philippines and to the colleagues that went into putting that presentation together. It's really amazing to see this health facility development plan, the five-star approach, really setting the pace for greening healthcare facilities and looking at water efficiency and energy settings. And there's integration of WashFit there, which is really key for the whole process. Just want to take a moment before introducing our next speaker to say we have over 85 participants on this call, and they're joining us from all over the world: Kenya, Cameroon, Venezuela, South Africa, Mongolia, the United States, Netherlands, Pakistan, Liberia, Niger. I didn't get them all, but this is really, really exciting and wonderful to see. I would like to next introduce Maiza Trikamegi, who is a WASH specialist from UNICEF in Mozambique. Maiza will be discussing scaling up national efforts to adopt the WashFit tool. Maiza, if you can hear us, I know there's a very active multi-sector working group for WASH and healthcare facilities in Mozambique. So please tell us about this effort for the national scale-up of the WashFit tool.
Thank you. Can you hear me?
Perfect.
Yes.
Okay, so this is Maisa, WASH specialist in Mozambique country office. I'll be presenting here the scaling up, some national efforts that we are doing to scaling up the WASH Field 2.
Maisa, why don't we pause for just a moment? Arabella, do you mind stop sharing and starting again? We're in presenter mode and part of the screen is being covered by a box. Sorry about that, Maisa. Give us just one moment. I want everyone to be able to see your great slides.
My apologies.
No problem.
Will I be able to change the slides, or will Arabella do it?
Arabella will do it for you here. Just
Okay.
one moment.
Is that better?
Yes, there's just a black box at the top, but I think it'll be all right. All right, Maisa, please go ahead. Thank you.
Okay, thank you. So a little bit of the context in Mozambique. The country has approximately 32 million people and more or less 1,700 healthcare facilities. Most of it are primary level healthcare facilities. 30% of these healthcare facilities are located in only 2 of the 11 provinces that we have. And these 2 provinces have 35 to 40% of the whole population and are the poorest provinces in the country. This is where the program is mostly, the program that UNICEF is supporting is mostly focused. The coverage of washing healthcare facilities is low in the country, although we don't have a national assessment that shows the coverage according to the minimum level of service that is needed on a healthcare facilities. We have more or less the idea that the coverage is very slow. The existing figures are from SARA, but these do not take into account an adequate level of service, for example, having running water or a separation of toilets. The WASH is spread in 4 different national directorates within Ministry of Health, so this makes quite complicated to coordinate. And since 2019, there is a national multisectoral coordination group that was created. This group was active at the beginning. Then when COVID came, it stopped a bit. So the members of the group were more working and responding to the needs of COVID, for example, designing guidelines for markets or for schools. But since last year, the group has been active again. Within this group, there are 4 sub-working groups that were created to have these departments within Ministry of Health, these 4 different departments working together. So the working groups were created following the 8 practical steps recommendations. So they are, at the moment, they are focused on the norms, on the roadmap, on monitoring and operation and maintenance. For the norms, there are some progress. There is a document you can see here on the right side. It's just a page from the document. And this group is working towards having this document approved and formally accepted by government. On the roadmap, there is also some progress in this group. There is clear objectives and the steps that needs to be taken to have this roadmap completed. There is an effort to have this roadmap included on the health strategy plan that it's going to start next year, a 10-year strategy plan. So the idea is to have this, the content of this roadmap being included on the overall health strategy. And then we have a group for monitoring. There was some work done within the Scorecards initiative, which is an initiative from Ministry of Health to evaluate the quality of health care services in the healthcare facilities. We were able to include some WASH indicators on these scorecards. The initiative is not covering all the healthcare facilities in the country, but it's covering at least 1/3, and the idea is to have this expanded. Then there is the operation and maintenance group, which has two focus. One is having a budget at healthcare facilities that allows for small repairs and small initiatives, and the other is the WashFit tool. So WashFit is being implemented by Ministry of Health, UNICEF and WHO and other partners since 2019. Next slide. Okay, so just a bit of the history or the progress that we had with WashFit implementation. Unfortunately, we don't have the overall idea of what's being implemented by all partners. We are making an effort within the multisectoral coordination group to have this mapped so we can have a clear idea, or Ministry of Health can have a clear idea of everything that's being done. So this slide reflects more the efforts done by UNICEF, WHO, supporting Ministry of Health. So the first thing that happened was to, so the language that is spoken in Mozambique is Portuguese, and the tools that are available don't cover Portuguese. So the first effort was to have this, the manual translated, and also the training packages. You can see here an image of this, the manual, the Portuguese version of the manual for the first edition. Then in 2021, there was a training of trainers done at the national government, mostly to the environmental health department within the Ministry of Health. In 2022, there were 7 provincial trainings covering 7 provinces. And we don't have here exactly the number of healthcare facilities that were covered. Then in 2023, there were 4 provincial trainings, so covering the other provinces. And Mozambique participated on a training of trainer regional training that covers the 2nd edition of the WashFit. This year, we are working in training 43 healthcare facilities in Zambezia, 7 in Nampula, and 23 in Sofala. And there is an initiative that we are calling coaching that is being piloted by UNICEF to 205 healthcare facilities. And the idea is we've acknowledged that trainings by themselves weren't being effective in implementing the WashFit. So the healthcare facilities, the healthcare staff needed more closely support. So we are thinking in this 1-year coaching, and we are assigning now partnerships with different partners, CSO partners to support in these activities. Next slide. The challenges that we have. So first, these challenges cover not only the WashFit, but the whole program, the whole WASH in healthcare facilities program. First is the prioritization by the health sector. So as I said, we don't have the clear coverage of WASH in healthcare facilities in the current country. We are missing some evidence to make this advocacy. Then what I've mentioned before, the coordination at the Ministry of Health, because of this spread in or distribution in different national directorates. The subgroups, so the working subgroups that are covering specific issues, they have competitive priorities. So they are composed by members of different departments, and the Ministry of Health is quite complex and big here. So it's quite complicated to keep these subgroups active and working. Then another challenge is to have budget for the WashFit trainings. This is most for a Ministry of Health. If there isn't a program by a partner, they don't budget for this training, or budget is very limited. Then another challenge is related with the timing for the WashFit implementation. I'll explain this a little bit more in detail. When we started the program, we were focusing on improving infrastructure. And then we wanted to use WashFit as a continuous improvement tool, so to make sure that the interventions are sustainable. And this was mostly because the healthcare facilities that we were focused didn't have any wash infrastructure. And even at community level, there wasn't a water source, so they were starting from scratch. And when we started looking at the WashFit indicators, and there was something that they needed to be able to manage. So this timing for the WashFit, it's something that we are still working by doing, where is the best time to implement. And within this coaching initiative, we have different experience. So we are starting before doing the infrastructure. The others we are starting while infrastructure is being done, and the others we are starting with infrastructure, existing infrastructure. The other challenge is related with the budget at the healthcare facility level. So this exercise is done, the WashFit, and then the healthcare facilities don't have a budget to implement small repairs. Last challenge is related with because there is this lack of infrastructure at healthcare facilities levels in general. There is a need to work on the infrastructure, and this becomes a challenge because it deviates the intention from the enabling environment activities, which are also very important for the long-term improvements that the country needs. Some enablers. So when WHO and UNICEF started to work with Ministry of Health in 2018, there wasn't many partners or stakeholders involved. Now we have seen more stakeholders being involved in this area. Some examples here of ETA's WaterAid and SNV. We need more because the needs are huge, but we've seen this progress. Another enabler is the significant size that the UNICEF Washing Healthcare Facility program has in the country. Just to give an example, since we've started, we had more than $20 million. This allowed for some visibility in the country and some experiences that we've been gaining with this big program. There is also, yes?
Liza? Yeah,
yes.
We just finish up in the next minute or so. We do have other speakers and several questions to go to.
Okay,
so
okay, sorry.
Thank you so much. Thank you.
Also, so another enabler is a strong partnership with WHO, and then having the WASH indicators included on the scorecards. Next slide. Okay, so this is the most important part here is the next steps, what we are planning and towards the scale up. So one is the stakeholders mapping that I referred to. This is quite an exercise that we need to do to make sure who's doing what. The lessons learned we'll be doing also through the coaching pilot initiative and from other partners. And then specifically for Scale Up, we have estimated, we are foreseeing the translation of the country manual to Portuguese, which will be signed, endorsed by the Ministry of Health. The other initiative is to have trainings being delivered by a national health institute. There are already some negotiations with Instituto Nacional de Saúde. Then we have certificates being issued at national level by this institute. And then we have the healthcare facilities being certified as being implementing wash fit. So to make them being recognized and have an accreditation system. We have also an implementation research in 126 healthcare facilities. So we will be reviewing the implementation and having lessons learned and recommendations for improvement of implementation. We also have the assessment of healthcare facilities that we would like to use different innovative modalities to make this happen, not to have a big investment. And the roadmap development, as I referred, and we'll be recruiting a consultant also to finalize and approve the norms document and to support Ministry of Health on roadmap development process. I think this is the last slide. Thank you.
Thank you so much, Maisa. It's amazing to see. That's great leadership at the ministry level and creating those subgroups to create the different steady progress actions for the practical steps. A lot of trainings have been done in the provinces, and yes, the next steps that you highlighted, a lot of good insights for the colleagues around the world. I'd like to shift now to Ethiopia, where we have Waltalji on the line and possibly Israel Ataro from the Ministry of Health. But Waltalji, as you're here, we know that the Ethiopian National Health System has rolled out the Clean and Safe Healthcare Facilities Initiative. Now it's renamed as the Catch It Initiative. Just a general question here. What have been the greatest challenges in using WashFit and integrating WashFit within these Cash and Catch It initiatives?
Thank you. Good afternoon, John. I think if Israel is online, let him respond to that.
Israel, are you with us? I'm not sure he was able to join, Waltalji. If you have any insights to share about integrating WashFit in the national health system, it'd be wonderful to hear.
If Ato Israel is not online, I just, because I didn't prepare anything, so I can give the insight over the last more than 10 years. Ethiopia started, I think, as you all know, before the WashFit started, the Cash initiative. That is Clean and Safe Health Facility that is in 2014. And since that time, there are a lot of trials to implement the wash in healthcare facilities through these initiatives. And later, the moment the WashFit came out, this initiative accommodated the WashFit to implement the Clean and the Safe Healthcare health facility, which later on upgraded to the Catch It. The Catch It is timely and a clean care for institutional transformation. This is mostly for the whole hospital in the it includes the time, because the cleanliness and the lack of the wash, the timeliness of the care provided to the people. So this has been included in 2019. And then recently in 2021, health post.
Daji, are you still with us? So there's definitely a lot of great stories going on in Ethiopia now with these national health policies and tools that have been rolled out, and how WashFit can play a role in integrating and supporting those. We hope to get Baltaji back and to maybe ask him a few more follow-up questions later in the webinar. Right now, I would like to shift over to Mali, where we have Dr. Afu Bengali from IRC WASH on the line. Afu, how are you? Can you hear me?
Yes, I can hear you, John. Can you hear me? Okay, great.
Yes, loud and clear.
Can I finish in 1 minute because it wants off? So
yes, great. Baltaji, please.
Yes. I think for Ethiopia, if anybody who has gone online, it's possible to see Ethiopia is, with some of the tracking, they are on the right track, but the main challenge is the infrastructure. For Ethiopia, a number of partners are now, we have a very functional and a vibrant technical working group with active engagement of the UN and also Ministry of Health and the different partners like World Vision, SNV, Millennium Water Alliance, Water Aid, and Catholic Relief Service. They are implementing the WashFit in number of healthcare facility, and the government is also trying to do using the WashFit. And we are now on the final stage to develop the roadmap, costed roadmap, where to be in the coming 10 years, because all the guideline and the standard is available, including the climate resilient healthcare facility guidelines. So that is where we are. But the problem is, if you look at the WHO UNICEF report, the coverage, the facility, the infrastructure is still low, because that is a capital intensive. So that is one of the big challenge for Ethiopia. The initial cost for the infrastructure improvement is very challenging, but partners are contributing to it. So those are the challenge area. Apparently, we have now moving even the energy to the solar. We are having now over 300 healthcare facility project now, which we are going to inaugurate next week and start in 2024, WHO, UNICEF, and the Gavi joint project. So the whole idea is how the healthcare facility is going to access the infrastructure. Unless otherwise, the other is almost in terms of capacity, in terms of document, standard, everything is in place, but the infrastructure is still challenging. Thank you.
Thanks so much, Baltaji from WHO, coming on short notice to share this. It's great to see there's a critical mass of partners and actors working at this. That's definitely what's needed for scaling up WashFit. So then coming back to Afu Bengali. Afu, you're the country director for IRC WASH based in Bamako in Mali. And your organization has worked for decades on supporting system strengthening. So supporting actors to be able to take steps on their own to strengthen the system. And you've been focused on the health system for some time, working with the Malian Ministry of Health to support the delivery of WASH services there. WashFit is a country, Mali is a country where WashFit was piloted. I think in 2016, 2015, the first pilots happened. And since that time, a lot of progress has been made. We know that Mali has had its fair share of challenges with socio-political upheavals and conflict. What is the scope, maybe my first question, what is the scope of using WashFit in a fragile context like Mali?
Okay, so thank you, John, and thank you to all the organizers for inviting me to share a bit about this topic on the WashFit, the implementation of the WashFit tool. So probably for those who do not know Mali, we are in a political crisis since 2012 up to now. So we are still going under political transition. That means that the country is under conflict, is a conflict area. And we have also some limited access to some region across the country. But despite all those security challenges the country is facing and social political challenges the country is facing, we've been able to implement the wash fit tool. And I think Mali will be, let's say, the best example of implementing this tool in a fragile context like ours currently. And as you said, since 2016 up to now, a lot of have been done in this challenging context by different partners, developing partners and government as a partner as well. And to say that, I can say that currently we have more than 250 health centers that have been covered by the WashFit tool implementation in the country. And this in 5 regions across the country. So for those who do not know, 5 regions out of 8 regions that is officially known across the country. So that means that there are some progress that have been done by implementing this tool. Then we've been able, one of the things I think that's very extraordinary for the country in terms of really convening and coordinating and putting together kind of collective action and synergy among developing partners and the government is we've been able to put in place or institutionalize what we call a national task force for WASH and IPC in healthcare facility in the country. And this is, I mean, a big innovation in terms of improving coordination, in terms of improving standards, WASH standards in healthcare facility in the country. But it's helped as well to even develop country strategies for WASH healthcare facilities. Then it has also a role to ensure that all stakeholders who are implementing the tool across the country there is a compliance with the national standards. So this task force played this role, and it was institutionalized by the Ministry of Health, which is a great progress. That means that at political level, the tool is being taken care of and is a priority. Then there is an interest from the country to use the tool. And right now, I think we are in the process of scaling up to other regions across the country. And I think those are some of the things probably we'll share, but we are, we've been able as well in this context.
Afu, could I just ask a follow-up question on what you just said? For the WashFit tool itself, can you just talk about how has WashFit helped to strengthen the WASH service delivery in the health system? I know you've prepared a slide on this, and I just wanted to come to that point because I think it's really, really interesting here for the colleagues.
Okay, so as you say that the WashFit tool can help to strengthen WASH service delivery in healthcare, in health system. And as an IRC, we've been implementing the WashFit tool in 9 healthcare facilities in the country. And our approach as IRC is based on system strengthening because when we talk about WASH, we don't talk only about infrastructure, but we talk about an holistic approach, a governance approach, and all this is around some key elements that we call a building block. And those elements are in total 9 of the elements, as you can see in the slide. So the WashFit tool, when you are using it, you can use by applying this 9 building block and it can help you as well to measure and to monitor your progress, to adjust, and even to redo your work plan again. So it allows to do that one, the wash. And the key example I will say that
Arabella, can you just
when
do one click on the slide?
Yeah.
Thank you.
So the
Go ahead.
quick example, the key example, as you can say, you have a different building block, and we've tried to see each of the building block, you can apply the wash fit tool. So by doing that one, you are able to really to measure what are the key progress when you're implementing the wash in healthcare facility by using the tool, the wash fit tool. And as ILC, we use this tool to implement our wash fit tool. And what we focus more in our past program, which was done in 2020 to up to 2022 in a 9 healthcare facility. And some of the key, I will say, key elements in the building block, you are focused more and with concrete example or achievement we've been able to do on that were on the institutional strengthening. Because when you look at this building block and when you look at the part of the institutions, so at local level, you see that there is always challenges in terms of coordination, in terms of role from the different actors across the institution. And as we work a lot, and that means that the wash field tool can give autonomy to the local authority for decision making, and it can help as well to identify what are the gaps in terms of capacity building for the health workers and even for the local authority, so that they know their clear role. And during the implementation of our project, we focus more on this one. And one of the things that I will say we've been able to achieve from this is the level of the leadership from the districts where we worked, the district authority, because they have been able really to take into account the importance of this tool for healthcare facility improvement to improve health. And they have even have a budget line that has helped really to secure, I will say, a salary for one of the health worker in one of the healthcare facility where there was no health worker in that. So they recruited and they were the one also funding the salary and everything. Because the
That's
implementation because of the implementation of this tool, the level of understanding and the institution, which is the town hall where the mayor is, it has increased their leadership capacity and to know what are the clear role that they have to play in this process. And the planning aspect, we've worked a lot on the planning aspect because in the cycle for the wash fit, you have a planning part that is putting in place the action plan or the wash fit plan for the healthcare facility. And this process, we did this process with the local authority. And why doing this?
Thank
the importance of having the local,
Afu, I'm sorry to interrupt. This is very rich. There's a lot of great content on the slide, and I'm sure a lot of wonderful experiences behind it. Thank you for sharing those highlights. We will definitely make this slide deck available. I'm just seeing that the time is passing, and I'm going to look to Lindsay if there's any question that's come out of the chat or anything that we should be addressing before we go to a wrap up from UNICEF and UNC. Thank you very much, Afu.
Thank you.
Thanks, John. I see one question in the Q&A section coming in about the Philippines presentation regarding whether there's any independent validation or verification of the results, or if it's based on self-reporting. Unfortunately, our colleagues from the Philippines, it's quite late for them. They were not able to join live, so we'll have to get a follow-up response to that question, and we can share that answer with you all. Great to see a few more comments coming in here. There is a question in here from Sam Triglon asking, or noting that it's very interesting to see that the use of tools at some scales can feed into wider WASH and healthcare facilities system strengthening. And the question here is, what methods are used to facilitate that process and to aggregate WASH fit findings? I wonder, John, if you have initial thoughts on that, and then Phil, if you want to point that to any one of our speakers.
Yeah, there's so many tools that definitely can feed into the wider Washington healthcare facility system strengthening. The methods used to facilitate the process, I think that the slide that Dr. Afu was just presenting with, taking a systems approach, looking at these different building blocks and how we can support the actors to unlock any kinds of bottlenecks that are there. So I think this kind of review and awareness that there are tools that we can apply like WashFit to seeing what could be done to support the actors to take on more functions and more roles and to see what we can do to enhance that.
Great point, John. And then one last comment here. I think it's more of a comment than a question, but looking to find ways in which we can support WashFit with grassroots organizations who are implementing WASH in institutions, including healthcare facilities. So great notes. And I think today, really fantastic to see such a diverse group on here. I think about 50 of you had not yet started using WashFit. So definitely sounds like a critical need to share these resources with you all, as well as to pass on connecting within the networks, such as in Uganda, where there's a robust group of individuals working on this tool. John, any further comments on your end?
No, I think that's great. I think that this might be the time to talk about what's next for this community of practice, and maybe some wrap-up statements. So I know Ryan Kronk from the Water Institute at the University of North Carolina is here with us. Ryan, you have some thoughts on what's next for the community of practice and for WashFit?
Yeah, thanks everyone. So as many of you know, UNC took over the community of practice from the Emory team. And we're really excited to launch a new webinar series in January that's going to complement these technical webinar series. So we will continue those into the new year. We will continue with the newsletters and curated information on the website. We're also expanding some activities. We're hoping to establish also some working groups. These technical webinar series are in response to the community's desire for more technical content. And then we want to provide opportunities for folks to engage even deeper on those topics. And so we're hoping that these working groups will get established, in the new year on either regionally or on technical topics like WashFit or water quality or budgeting and costing, or a regional group like East Africa. The groups will agree on a terms of reference and have some kind of target output to share with the broader community. And these are meant to be member-led. UNC can help co-facilitate and sort of help track inputs and that sort of thing. But we really need this to be led by the community. So be thinking about that. And we do have, I think my colleague Darcy is going to drop into the chat a very quick survey. If you have any preferences for working groups or want to tell us about groups you're currently working in, please share that with us. And this is just a teaser. We'll talk more about this in January. Thanks.
Thank you so much, Ryan. Really exciting to hear about all the things taking place with the community of practice, and certainly to carry forward all of these great discussions. I think we had some really rich examples today, hearing from our colleagues in the Philippines, Mozambique, in Ethiopia, and of course in Mali. So please join us for future sessions, and as Darcy puts in there, let us know what would be most useful for you as part of this community of practice. And we'll certainly be following up in the new year. The WHO UNICEF technical webinar series that we put together, this is the first session. The next session takes place on December 5th and will focus on healthcare waste management, and in particular, green technologies for healthcare waste management. So please be sure to sign up for that. Come join us. We will share around the link to register, and the materials and everything that was put together for today, all the slides we will share after this, in case you wanted to check out Afu's slide or take a look at those slides from the Philippines. So thank you again to our fantastic speakers. So grateful for you all sharing your experiences. I know you all are very busy people, and all of you for joining us. A really rich discussion, and we'll be back for more. Thank you again, and have a great rest of your day. Take care. Afu. Oh, Maggie, you're on mute if you're trying to chat.
Oh, bye-bye. Thank you, everyone.
Thank you, Afu. Thank you, Maggie. Thank you, Waltaji.
Ciao.
Ciao, ciao. Take care.
Thank you.